I'm Sue Rabati, and this is Jonathan Block. We're both from Medshadow. I'm the founder, and Jonathan is the content manager. Today we're going to talk to you about conditions of life that are somehow becoming elevated into diseases. When I was a kid watching TV, there was this terrible disease that was going through a scourge of the nation. It was halitosis, and everybody had to use Listerine to get rid of it. When my vocabulary expanded, I found out it was bad breath, and that good dental care and brushing your teeth and not eating onions would take care of most cases, most times, of bad breath. So it wasn't really necessary to buy this medicine-y thing. But that was the beginning of a wave of products that pharmaceutical companies have developed that take everyday aging or life occurrences and are turning them into diseases. And we're very concerned about this, aren't we?
Yeah, what you're talking about is something called disease mongering, which is taking conditions that are just common, everyday occurrences, sometimes they're just a consequence of aging, and turning it into something where you think it's a serious medical condition that if you don't have it treated, it's going to significantly impact your health or well-being. You were just talking about restless leg syndrome. There's a drug out there called Requip, and that was originally developed for Parkinson's disease, and it got a secondary indication for restless leg syndrome. And in most cases, most people that have been diagnosed with restless leg syndrome really don't have that condition. A very small percentage of people actually have it. Most of the time when you have restless legs, it might be because you don't have enough sleep, you're suffering from stress or anxiety, or you may be drinking or smoking too much.
You mean too much coffee?
Exactly. So put that cup down.
Sorry, you're right. What about esophageal reflux disease?
AKA acid reflux?
You mean gas?
Exactly.
And do you have to take a medicine for that?
No, that could be a consequence of eating spicy food. Some people are just more sensitive to eating certain foods, so there's a very easy way to take care of that.
Do you mean I shouldn't have 5 jalapeno poppers?
Probably not, because not only would that impact your stomach, it would probably raise your cholesterol a great deal.
Thank you for taking care of me.
Mm-hmm.
What else is a made-up disease or an exaggerated symptom into a disease?
A good one is the drug called Adyi, which is for something called, I have to look at this, hypoactive sexual desire disorder. Mm-hmm. This made the news last year when the drug was approved. It was called the quote-unquote female Viagra. Drug company decided that since men had Viagra and other similar drugs for erectile dysfunction, that there should be a similar drug for women. It had very tenuous research, thank you, conducted for it. And the good news with this one is that since it's been on the market, the drug has kind of bombed. It hasn't really been selling very much as doctors realize that it's not a real condition and the drug itself doesn't work at all.
The issue with a lot of these diseases are that once you start with the cure, with the medicine, even sleeping aids, there's a rebound effect that will keep you from not using it if you use a sleeping aid, and by that I mean the over-the-counter ones or the prescription ones, the next night you will have more trouble getting to sleep, therefore need it again, and the following night, and so forth, because you've interrupted your natural sleep pattern. What about overactive bladder?
Well, that's another condition that is a consequence of getting older. There were pharmaceutical companies that decided to elevate that from just kind of an inconvenience or annoyance to, again, something more serious that required medical attention and necessitate taking a prescription drug. One thing that we haven't addressed with all of these drugs for questionable conditions is that many of them have side effects. Another class of drugs that has come on the market recently are so-called low T or low testosterone drugs, which is really more of a quote-unquote lifestyle drug. But doctors have said that low T isn't even a real condition, and taking one of these gels, which you would actually just rub on your skin and it gets absorbed that way, actually doesn't do much in terms of increasing your sexual health, and they do come with several risks. Most seriously is a risk of coronary artery disease. So it's important that for some of these conditions that are very, very questionable, that there are serious side effects with the drugs associated with them.
If you'd like to learn more about the side effects associated with the drugs that you're discussing with your doctor or that you're seeing on TV, please go to www.medshadow.org and just search for the drug. It's very likely we have something to say about it. In the meantime, taking a drug for a condition that is not serious and not life-threatening, or that can be treated in a lower tech way, is just plain dangerous. So please think carefully and balance the risks and the benefits of every drug you take. Thank you.